when I'm on the Bosporus, as you can see,
Yeah.
the sun in our back. I don't know how you're getting this, but it's the new camera, so we'll see how this does.
Nice.
I have today with me a special friend. He works in the Netherlands. In which hospital are you working now?
Now I work in one private hospital, medical clinics, Velzen,
Yes.
as a special clinics for the only transgender surgery.
Yes. So, Dr. Milos is originally from Serbia, and did his studies there. Then came to the Netherlands and had to redo everything to get integrated in the Netherlands,
Yeah.
learn the language, do everything, and became the most well-known gender surgeon in Europe. Your name is up there.
Yes, of course. In Netherlands, I'm most famous pioneer of the gynecology surgery and
Yes.
transgender care, and I sit almost for 20 years in transgender care, and there are many things which are changed in this period of 20 years, also by the law and also in the techniques, instruments. Now we reach the level which is amazing, and the risk for transgender surgery is unbelievably low. When the expert do this surgery
Yes.
this time, it's less than 1%.
Exactly. So going back to what we're talking about today, and specifically Dr. Milos, what he does is the roughest way I can say it, and we'll go into the semantics and details of this, but it's basically turning a woman into a man.
Yeah.
Kort door de bocht, as
Yes.
they say in Dutch, so people can understand. And we'll go into the sensitivities and everything else, because it's not that simple. Really, we're talking about someone that is born genetically
Yeah.
a female, but
Yeah.
feels strongly inside
As a man.
that they are a man.
Okay.
And so what you're able to do then in the end is basically bring the inside out and show what outside also what's inside. So I want you to go ahead and take us through this. As someone who doesn't know, this is not my specialty, this is not where I come from, but this is your specialty. You are the name in this. Go ahead.
I think that will be interesting for the audience that first to learn what is the term in gender care. You must know some things. Every human being is born with some genetics material. There are different sort of genes, but we focus to the sexual genes. We have two package. One is XX, and we call this a woman.
Yeah.
This means somebody is born as a woman, and similarly we have XI. This is
XY.
XY, excuse me, and this is born as a man.
Yes.
Now this is one part of the human beings. The second is how these people feel, how they experience is gender, where they belong. They depend themselves, and somebody can be cis woman and feel as a trans man.
Yes.
And this is my interesting area.
Yes.
I operated cis women who want to transform it in the man, and we call this trans man. We have also the opposite. We have somebody who is genetics man and want to be a woman, that is trans woman. And we have the third group, and these are non-binair. They are gender neutral people.
Yes.
This is a short description how we make classification.
Okay. And now I know that in the Netherlands, insurance, the government actually pays for
Yes.
this whole procedure. And it's not just about the surgery. I don't want you to go into that, but it's a whole 3-year process that these patients go through for transform, starting with an intake that takes sometimes years to really establish psychologically and in every sense that this is a true person in the wrong body.
Yeah. All
Tell
this
us about
person, yes, all this person has everything start with his own choice. They feel something inside, mentally, that they don't belong to this body, they belong to another gender. And with this question, this problem, they go to experts. You have first year, they are busy with psychologists and psychiater and endocrinologist give them the hormone therapy, because they start with the hormone therapy. They use everybody testosterone. It is a male hormone, and this hormone is very important to make different change in his body. For example, they take the barb.
They get hair growth, they get beard.
Yes.
But what level of testosterone is usually it's pretty high level?
This is a pretty high level. The first year is very difficult because they are still in the one. You can compare this as a journey. You go to fly and you never know where you come. You have your goal. You want to fly there.
Yeah.
But there's many steps, and the experts started with the first part of the treatment till the end. The surgery make only the transformation physically, but mentally, where the hormone do this transformation. The hormone has influence of mentally change, of course, but they keep it also physical side effects. All the trans men 100% want to remove the breast.
Yeah.
They look as a man.
They want a breast removal.
Yeah, everybody wants to remove the breast, and then you have the different level of the transformation. The people go in from only very superficial change, breast remove, till the penis reconstruction.
Yeah,
and
penis reconstruction. But before that, you need to do uterus removal.
Yes.
And then there's a decision: do you only remove the uterus or do you remove everything? Talk a little bit about that.
This is a very good question, because I take them many times and I discussed very long with my clients. I say clients because they are not patient. The patient is somebody who is sick. Come to the doctor. These people are not sick. These people want to change something in his mind. They feel something, and we must respect this, because this is their decision. They feel it very good, especially of the transformation. And when you talk with these people, do you understand them or not?
Yes.
And this is
they're very intuitive.
Yeah, and this is also very important. We are there. I'm there as a surgeon, not to get influence of their decision. I'm there to help them to make his goal true.
Yes.
And I'm only in one part of their journey behind them, and then I leave it.
Yes.
And this is only this physical transformation. I help them. If they want to remove the uterus, almost everybody who come to me and they want to be a man, they feel uterus not necessary. This is not something what belongs to a man. They want to remove the uterus, and this is a good decision, because if you leave the uterus, you can get a problem. You can be pregnant. You can get different disease, and you can get cervix cancer, because this HPV virus is the reason.
Yes.
Okay.
So uterus is a good thing to remove.
Yeah, uterus is for sure good things to remove. I will be recommended to everybody.
Yeah.
Because there is no another goal. This is one muscle suck only to born the child.
Yes.
But nobody wants to born the child.
Yes.
Then we come to the second thing, which can be very important, and this ovary. Ovary are the organ who make the cell for the oocyte, egg cell, of course. And that can be in connection with your future generation. Do you want to have the baby, your own child, genetics?
So they can still have babies, even though with a complete operation, with everything.
Yeah.
They still have the option to say, okay, harvest some eggs from my ovaries, and I still want to have a baby, although I'm completely changed from the outside.
Maybe seems crazy, but if you have eggs, at the moment, the fact that you have eggs means that you can have genetics your own child.
Yes.
And the technique and everything.
So that's a big choice for someone to make.
So anyway, we magically transported ourselves from the boat on the Bosporus to the home.
It was a wonderful journey.
Yeah, it was a nice journey.
Yeah.
To continue this talk about, this insight about transgender, and specifically when women feel that they are biologically a man on the inside and want to express it. This is kind of what you do. And we spoke about 3 specific areas that need to be considered, which are not one, but they're 3 separate areas that work independently of each other.
Yes.
And so,
and they mixed with each other, because every year with 20 years experience, I learn something, and I'm very interesting how they feel, these people. Now, I think my conclusion is there are three things. One is the nature, genetics. You are born as cis man or cis woman. The second is how you feel, what you feel, where you belong,
right.
your emotion, about your gender orientation. And the third one is sexuality.
Okay.
And this now I separate all three things in separate part, but they can mix.
Right.
Each transgender make own choice.
Yeah, decisions. Because I think we are always under the assumption that if, and you were too at a point where you said, okay, a woman comes in, wants to be a biological man. She wants to convert her body to a man's body, which, you know, you go through the whole process. And then in the end, when she all of a sudden becomes a man, our assumption would be that it's because she wants to go out with women. But that's not necessarily true.
Yeah, and what is interesting, this process is definitely not finished. When you finished with your surgery, the medication testosterone is a long life. But just when you come in the position that you finish with your transition, then start the new journey. Then you must accept it, your new body.
Yes.
And this is then your mind must accept it, this transformation.
Right.
Because it is not nothing.
Yeah,
you change
it's
completely.
It's a complete change in everything. But like I said before, the point I was trying to make is that they can choose to still be with a woman, be with a man.
Of course,
and
of
they
course.
do that.
They do that.
Even
I have many example. They do that. Different partner. Somebody who is a trans man chose for the woman as a partner. Another one for the man.
Yeah. Okay.
This is the reality.
So that's why you separate those three, because they're not.
Yes, that's what I separate. And there are before. The transgenders were very close. They don't want to express their emotion experience. And now I see that the new generation is more open. They talk about this, and they learn me that a difference in this sexuality. I didn't know before.
Yeah. And tell me, there is one particular patient that influenced you a lot, that taught you a lot, that you know still works with you. Yeah. Tell us a little bit about that.
This is one person who made a great impact and impression of me. I know him because this trans man. I met him 20 years ago in the beginning of my career. And he
was already a man?
He was already, in this moment, he was already busy with the hormonal transformation. He started with hormone therapy with testosterone. And I know him in this period. Okay. And I can show the change from the voice, the barb, the hair, everything. The change the mind. After that, we do gender surgery.
Right.
When he finished the gender surgery, he decided to be psychologist for the gender care.
Okay.
Now he has own practice anyway in Netherlands.
Yeah.
And he helped another transgenders to make easy this journey from nothing till the completely mental and physical transformation to trans man.
Yes.
And we work together. We are in contact. He sent all his clients to me.
Right.
I operated. This is very, very important that we make this network.
Yeah.
And the people must feel are safe in this.
In
network.
In network and environment. And so he taught you a lot. You saw his progression. You've seen him for 20 years, so you've really seen him change through the years.
Yes, and he helped me very much because he is one sort of insider for me in this group. Right. He gave me the tips, what is the best, how I must help these people, how I must manage these people. He learned me very, very much.
Yes, so
and that's the best way.
He let you walk a day in his shoes, kind of.
Yes.
Yeah. We always need teachers. I think patients are our biggest teachers, and
for sure.
Yes.
You can best learn from them. If you ask them, then you come deeper in their emotion. Anyway, if you go only and read something of the internet, it's black-white.
Yeah.
This transgender world is not so black-white.
No.
There's very many variations.
And I think also the thing about, as a surgeon, you can learn technique, you can learn what to do, you can learn the procedures, but if you want to really treat a patient, you have to go beyond that. And especially with transgender, that whole journey is so much, it's so long, and it takes so many professionals to come in to that journey.
Absolutely.
To be able to do it. So it's a very unique.
I think that's very unique, and maybe in the future the world must be busy to make this care better with more experts. But the experts must be people who has a heart for this sort of care. This is really specific care, and if you come inside one time, then is the passion. You cannot go out. I don't want to go out because these people need management help. I like it. I see transformation. You see your results. And this
but it's a lot of. I mean, it's a big mental thing too. It's huge.
Of course.
I mean, the biggest thing is probably the mental.
Of course, and this is the reason why I use so feel energy to management these people mentally. Because if you are only black-white, I'm the surgery, they come to visit me, I make the operation, I remove the uterus, and then I say, okay, I don't need to see you anymore. This is not good way. The good way that they feel that you are always for them, also if it's not necessary, but that you leave this message.
The process, the whole process. Exactly.
Before we stopped, I want to thank you for your hospitality, and I enjoyed a few days here in Istanbul. Yesterday we was on a wonderful journey on the Bosphore, and it was a great day. And today also, thank you one time.
You're very welcome. You're very welcome. It's a pleasure to have you here and to have your knowledge.
Okay.
So,
thank you. If you learn something from me, I will be very happy.
There we go.
Okay, bye.
Subscribe, ring the bell notification. We got you covered. Bye.